We'd like to welcome you to the senior panel on change, presented by the Schaumburg Bonn and the Prairie Center of the Arts. We usually are a group of seniors that meet monthly to talk about changes in the past, the present, and what may happen in the future. But today we are going to invite several non-seniors to talk about seniors in honor of the Older American Act, which is 65 years old this year. Could you introduce yourself, Algean, and tell us?
I'm Dr. Algean Garner, Director of Health and Human Services for the Village of Hoffman Estates, and our department provides both physical health and mental health services for the community.
I'm Gerry Bryant. I'm the Supervisor of Human Services for the Village of Schaumburg.
And I'm Barbara Adrianopoli from the Schaumburg Township Library. I'm Director of Branches and Extension Services, and the Extension Services provides homebound service and institutional service to the members of our community.
And I'm Gerry Bartnicke. I'm Director of Senior and Disability Services for Schaumburg Township.
Thank you very much. We'd like to welcome you, and we're going to hear a little bit more about each of your jobs that you have that help us as seniors. But we would like to take a little look into the past. The Older American Act is 65 years old this year. And if we have to look back in the past to understand why there is an act. When we first started our country, it was an agrarian society. Families lived together, and as they aged, each one took care of the other. There wasn't much mobility. They more or less lived on the farm, and they provided their own things that they needed. But as the world started to change with the Industrial Revolution, that brought people from the farm into the city, where they were able to earn a wage and live a different type of life. The urbanization of America really came to its forth in the 1920s, when at that particular time, more than half of the people of the United States lived in cities rather than on the farm. And with that, there was a demise of the extended family as we know it. Further, there were innovations that came about that furthered this separation. And Henry Ford, with his 8-hour day and $5 a week, made people able to earn a living wage. Then we had the Depression and Franklin Delano Roosevelt with his New Deal. On top of all this, we were all living a much longer life. Life expectancy increased. And with this increased, we had the concern of policymakers that there was a lack of community social services for older people. Many were living by themselves, some of them below poverty, in terrible conditions, even nursing homes well back then. I mean, it was a place, as Lyndon Johnson said, it was a place to put somebody in just to wait to die. So the law did establish grant programs to serve the seniors in the community so that they were able to remain independent and live a dignified life and avoid institutionalization. This act brought about 4 different programs. And on this program, we had supportive services, where seniors receive legal, transportation, and health aids, nutrition and meal service, centers for eating and home delivery of food, disease prevention and health promotion, health screening, education and training, and national family care support programs, where there was counseling and training to assist caregivers. So this is all aimed at seniors. And before we take a step into what you are doing now, could we look back into your family life? When you were growing up, were you an extended family where you had maybe an aunt, uncle, nephew, grandparents living with you? Or were you a nuclear family, a mother, a father with children, or a mother with children? How would you say that your family life has changed? Barbara, would you like to start?
My family life, there were 8 children in our family, so I think my mother would have said she had enough already. But in the summers, we would go down to my grandparents' farm in Iowa, and we spent the summer learning how to bring the cattle back from the pasture to milk, corn husking, and feeding the pigs. And
so it was an agrarian
eggs.
society.
So it was agrarian. It was so much fun.
Mm-hmm. And did you live with your grandparents at the time?
Yes, my grandparents. Our longevity runs in our family. They lived to be. My great-grandmother was also there, and she lived to be 109. And my grandmother lived to be 107. And
my gracious, that was an extended family.
Yes.
And how about you?
Well, I grew up in a nuclear family with a mom and dad and a brother and a sister. We had an intention actually of being an extended family because when my mother's mother died, we were in the process of getting ready to build a new house. And so we built it for my mother's father to move into our home. And we would have been an extended family then. And he did move into our home, but unfortunately didn't live longer than a couple of months after he moved in. So there was an intention to be an extended family.
So you were going from a nuclear to the extended. Right. Mm-hmm. Jerry, how about you?
We did have an extended family. Grew up with mom, dad, and 2 brothers and a sister. But my mother's father died very young, and her mother came to live with us. And I can't remember a time when Grandma wasn't in the household and was part of the household. Also, we had aunts, uncles. Everybody was very close. Family was, it was centered around your family, everything you did.
You really had the thought of the Chinese proverb that having an older person live with you is like having a jewel. We'll be back in just a moment.